Once again, welcome to our Health Optimizing Physical Education 2 or Hope 2 class. So we are now in our Module 2 or Lesson 2, which is all about self-assessment of body composition and cardiovascular endurance. So before we proceed to our next lesson, let's have a recap first on what we tackle in our lesson 1, which is all about role of sports and managing stress. So the direction here, you need to answer the following statements by arranging the jumbled letters. So you can pause this video if you want to answer, okay? And then after that, you can proceed in watching. So let's answer na po for the number 1. So it says here that it is a reaction of the body and mind to unkind or challenging life incidents such as tense feelings, worry, and discomfort. So the answer is stress. So for number 2, it is an event or situation that causes a stressful situation. So the answer is stressor. And for number 3, it is a feel-good hormone that helps the body relax. So we have endorphin. And for number 4, it is defined as the capacity to respond and recover from something stressful. So the answer is coping. And for the last number, it is the harmful physical consequence of stress. So the answer is distress, okay? So if you get all of them correctly, meaning you still remember what we tackled last meeting. So congratulations and good job, okay? So now let's proceed to our next lesson. So in our expectation, the most essential learning competency we have self-assesses health-related fitness or the HRF status, barriers to physical activity assessment, participation, and one's diet. So specific objectives at the end of this lesson, the learners will be able to explain body composition and cardiovascular endurance and its benefits, perform the self-assessment procedures of body composition and cardiovascular endurance, interpret assessment results according to health and fitness standards, recommend sports related activities for the improvement of self-assessment results, and appreciate the importance of self-assessment on body composition and cardiovascular endurance and its contribution to a healthy lifestyle. Okay? So, participation in sports activity helps to reduce body fat and control body weight. It gains satisfaction in developing fitness and skills. So, in order to maximize the benefits of participation in sports, fitness assessment is needed to know what component of physical fitness should be improved. So, what is fitness assessment? So when we say fitness assessment, it helps to measure various aspects of your body and its abilities. It identifies the current fitness levels and serves as a baseline or starting point of physical fitness. So when we say naman for physical fitness test, it is a set of measures designed to determine one's level of physical fitness. Okay? So there are two components of physical fitness test: the health-related fitness and the skill-related fitness. So each component comprises several tests and specific testing protocols, okay? So for the health-related fitness, it involves exercise activities that you do in order to improve your physical health and stay healthy. So particularly in the categories of cardiovascular endurance, muscular strength, flexibility, muscular endurance, and body composition. Okay? So in health-related fitness naman po or HRF assessment, it is a series of exercises that help evaluate your overall fitness level and physical status. So evaluating your overall physical fitness helps you know your strengths and weaknesses. Being aware of your health-related fitness status, you will be able to create a good personal fitness program with appropriate fitness activities to strengthen the areas that you need to improve while observing a healthy lifestyle. So now let's talk about cardiovascular endurance. So when we say cardiovascular endurance, it is the ability of the heart, lungs, and blood vessels to deliver oxygen to the body tissues. It requires a strong heart, healthy lungs, and clear blood vessels to supply the cells with oxygen your body needs. So here are the examples of cardiovascular exercises. So we have running, brisk walking, cycling, swimming, dancing, and kickboxing. So if you have a strong heart and lungs, you can exercise your entire body for a long period of time without getting tired. So a person with a high level of cardiovascular endurance can sustain moderate to high intensity physical activities needed in playing sports without difficulty in breathing. Okay? So we have the benefits of cardiovascular fitness to health. So the first one reduces the risk of developing heart disease by increasing the efficiency of your heart, lungs, and blood vessels. Second, it aids in maintaining a healthy body composition. And third, allows you to train harder during strength sessions without feeling tired. And the last one helps lower the risk of high blood pressure. So marami tayong nakukuhang benefits kay cardiovascular exercises, okay? So now let's have this body composition. When we say body composition, it is the amount of fat cells compared with lean cells in the body mass. So it is the percentage of the body fat compared to the percentage of the lean muscle tissue, okay? So the lean body mass daw is the non-fat tissue of muscles, bones, ligaments, and tendons. It is measured in a skin fold thickness. So, when we say lean body mass, it increases physical activity, and diet can decrease body fat is the body's relative amount fat to fat-free mass. So, having a healthy body composition helps to achieve optimum physical and psychological functioning. So, exercise and proper nutrition are the two components for keeping healthy body composition. So, yun naman talaga, yung exercise at saka yung proper nutrition. Okay? So, a healthy balance between fat and muscle is vital for health and wellness throughout life. So, scientific evidence shows that a healthy body composition will increase. So, this is the benefits of healthy body composition. Increase your lifespan, reduce the risk of heart disease, cancer, diabetes, insulin resistance, increase energy levels, and improve self-esteem. So, marami pong makukuhang benefits kapag healthy ang inyong body composition. Okay? So, monitoring the body weight, an increase in body weight and also mean a chance of developing health problems. Ayan, of course, kapag hindi po natin na-monitor ang ating body weight at bigla na lang tayo tumaba or bigla na lang tayo pumayat, meaning there is something wrong with our body. So, knowing two numbers may help understand this risk. The body mass index or the BMI score and the waist to hip ratio. So, body mass index daw or the BMI is the one way to tell whether you are at a normal weight, overweight, or obese. So, measures your weight in relation to your height. So, the formula for BMI or the body mass index you have here, you need to have your weight in kilograms divided by your height in meter. Okay? You need to multiply it by 2. I mean, kung ang nakuha nyo pong height 1.50, you need to multiply it by 1.50 also. Okay? So for example, your weight is 50 kilogram and your height is 1.50 meters. So the computation would be 50 divided by 1.50 to the second power or 1.50 times 1.50. You will get 2.25. So 50 divided by 2.25, you will get 22.22. So this is your body mass index. So below here, you have this table on how you can interpret your BMI. So kung hahanapin po natin si 22.22, makikita natin siya, nandito siya sa normal, ang kanyang interpretation. Meaning, normal po ang kanyang BMI, okay? So, try doing this, okay? So, now, let's have this waist to hip ratio, which is your WHR. So, it measures stored body fat percentage by the relative measurement of waist and hip. So, the formula for WHR we have waist circumference by centimeter over hip circumference in centimeter also. So for example, you are a female, your waistline is 76 centimeters, and your hip line is 92 centimeters. So the computation would be 76 divided by 92, and the answer is 0.83. So we have also here the table for the interpretation. So of course, you are a female, you're a woman. So ito, hanapin natin si 0.83. So, makikita natin ang kanyang interpretation is moderate risk. Ibig sabihin, okay siya. Okay? So, now let's have your activities. For your pre-activity, I have here a physical readiness questionnaire or the PARQ. So, important reminder, it is important to know your health status before engaging in self-assessment of physical activities. So, start by answering the questions below. If you are between the ages of 15 and 69, the physical readiness questionnaire will tell you if you should check with your doctor before your start. Okay. Huwag lang po basta-basta na gawin, okay? You need to check for your health first, okay? So, ito po yung physical activity readiness questionnaire. So, ang direction here, you need to read the questions carefully and answer each one honestly. Common sense is your best guide when you answer this question. So, check yes or no lang. Okay, for example, has your doctor ever said that you have a heart condition and that you should only do physical activity recommended by a doctor? And if yes, yes. If no, no. Okay? You just need to answer this 1 to 7. Okay? Ayan. You can post this video if you want to answer the or a screenshot, make a screenshot, okay, for you to have for you to answer the physical activity readiness questionnaire. Okay, let's move on. So, if you have answered daw, so the evaluation of the PARQ, if you have answered yes to one or more of the above questions, ayan, kung may sinagutan po kayong yes doon, kahit isa lang po or mas marami pa, kailangan po muna mag-consult to your physician before engaging in physical activity. So, tell your physician which question you answered yes, okay? So, after a medical evaluation, seek advice from your physician on what type of activity is suitable for your current condition. Kailangan po mag-seek advice muna baka kasi may mangyari sa'yo or something, di ba? Or hindi nyo kayanin. Ngayon naman po, if you answered no to all questions in the PARQ, then you can participate in the fitness assessment and start becoming more physically active. So, reminders natin, wear your appropriate clothing, t-shirt, jogging pants, rubber shoes, or any comfortable clothing. And then second, secure a surrounding free from any obstructions. And then third, warm up first before doing the activities, okay? So let's have the activity 1. It's called self-assessment of cardiovascular endurance. So ang tawag dito is a 3-minute step test. So our equipment, stopwatch, cellphone 12-inch bench back. So your goal in a constant pace step on and off the bench for 3 minutes. Okay, you can read the procedure and how you can make this at 3-minute step test, okay? You can post this video. Then after that, by doing that, ayan, immediately after the exercise, locate your pulse. Give 5 seconds to locate the pulse. Don't talk while taking the pulse beat. Count the pulse beat for 10 seconds and then multiply it by 6. Okay. So, ito po yung interpretation niya dun sa ginawa niyo. Okay? And then after that, in activity 1, letter B, fill up the table below. Ayan. Yung ginawa niyo po, and then your heart rate, the interpretation, and then the implication. Okay? And then for your activity 2 naman po, self-assessment of body composition. Ayan, so ito po yung kailangan yung fill upan muna before doing this BMI. Yung tinuro ko po kanina sa inyong formula to compute the BMI, okay? And then, also the WHR, kukompute nyo rin po. And the last one is the, you need to complete this table, your score results for the BMI and WHR and then fill up the interpretation. Yun lang po yung activity nyo, okay? So, para po malaman nyo kung healthy ang inyong body. Okay. So, yun. So, for that, thank you so much. And I hope na magawa nyo yung activity. and see you on our next lesson. Thank you.